Good morning, everyone, and welcome to the California Department of Aging's 7th installment of our Ensuring Equity in Aging webinar series. Very pleased to be joined by 3 fabulous speakers and 5 representatives from the community today, and we'll do some introductions in just a few moments, but first I'll go over these logistics. You may join by telephone or webinar, as you already have. American Sign Language interpretation is available, as well as closed captioning. The recording, slides, and transcripts of all of CDA's Equity and Aging webinars can be found on our Equity and Aging Resource Center, and the recordings can also always be found on our YouTube channel. So we will post all of this later today or tomorrow. Questions and comments are absolutely welcome throughout the presentation. We have the final 10 minutes of the webinar reserved for questions and comments, but you also can go ahead and use the questions feature at the bottom of your screen to ask questions using your touchpad or your keyboard during the presentation, and the speakers may be able to engage with you as the presentation goes on. Next slide. So this, as I said, is our 7th Equity and Aging webinar. We have these the first of every month. We are hosting them at least through next month. We always feature state and local speakers with expertise in the subjects of cultural competency, equity, and program and service delivery. I'm really excited about this series as part of our California for All Ages campaign. Next slide. And we hope you can join us next month. We will be focusing on culturally informed policy and programs with and for older immigrants and refugees. More details to come on that. You can again register at our Equity and Aging Resource Center on California Department of Aging's website. And now I'm going to pass it over to our director at the Department of Aging, Kim McCoy-Wade, for introductions.
Thank you, Amanda, and thank you to the 137 of you who are joining us this morning to talk about this incredibly important topic for aging, which of course is dementia, Alzheimer's, and all dementias. I'm really excited for today's program, where we are focusing on dementia, which of course is more common in older adults, with that equity lens baked in, recognizing the disparate impact of the disease on people who are diagnosed with dementia and family caregivers who bear both the joys and the responsibilities of providing so much care. And of course, what we learned in COVID, even more than we already knew, was the intense risks to health, to well-being, to isolation, to so much more, both at home and in nursing homes. The challenges facing people with dementia, their caregivers, their loved ones, are enormous and are urgent. So with that, we are thrilled that our former First Lady, Maria Shriver, has led the BOLD Alzheimer's Task Force, and that we have aligned that with the Master Plan for Aging, so that all of our goals for age friendly in the master plan are also for dementia friendly, whether it's housing, health, inclusion, caregiving, or affordability. Dementia and equity are woven throughout. So that gives me hope that we have bold leadership from Maria Shriver and our governor. I have to say, our president, Biden's new call for a cure to Alzheimer's, diabetes, and cancer gives me great hope. But perhaps most of all, what gives me hope is the work being done by the leaders we have assembled here today. And so without further ado, I will briefly introduce each of them and then turn it over for the great conversation we're going to have. So Daniel Gaytan will be our first speaker. He's the Public Policy Manager for the Alzheimer's Association's Orange County chapter, and he oversees grassroots advocacy in Orange County and parts of LA and the Inland Empire. He's been with the association for 4 years and came from DC. So did I, Daniel. Good to know that. I'm an earlier era, but Daniel is from Obama administration and a congressional staffer. Victoria Jump, I work very closely with, is the director of the Ventura County Area Agency on Aging and has been with the county for 18 years. We are grateful for her expertise and her relationships and her commitment to connecting older adults and caregivers to the resources that make a meaningful difference in the quality of their life and their independence. And Valeria Ochoa, the community educator for Southern Caregiver Resource Center, another longstanding partner of ours. Valeria conducts free workshops, training, and classes on caregiving in both English and Spanish, and has a background in public health, working with diverse communities and addressing health disparities. and uses those strengths to empower communities. Thank you for that important word, with knowledge and awareness, as well as connections to vital services. And last, but in fact not least, we will be joined by Californians with firsthand experience with the disease and with caregiving. I'm so grateful to Florence Lam and Yolanda Rogers, who will be joining Daniel in sharing their experiences and their lessons. So with that, I'm going to hand the mic to Daniel and get ready to listen. Thank you so much.
Thank you, Kim. I appreciate the opportunity to be here this morning with all of you. And I'm going to dive into our Facts and Figures special report for 2021. So just to give you all a little bit of background, every single year, the Alzheimer's Association conducts a Facts and Figures report, excuse me, that provides an insight into the latest statistical data about this disease on a nationwide level. And in addition to that, it provides a special report which looks into a very specific facet into the disease. And this year is on race, ethnicity, and Alzheimer's in America. And as you can see, one of the quotes that we opened up this report with is, for decades, we've talked about equitable access to health and health care for all communities. However, we all know that we're still far from that, from achieving that, but we're all here working together to try to get there as soon as possible. So we can go ahead to the next slide. So a little bit of background on the special report. What we did this year was, well, last year actually, we released it this year, but we conducted 2 nationwide surveys with US adults and with Alzheimer's caregivers, about 2,500 US adults and about 1,400 Alzheimer's caregivers. And the respondents included folks from the Asian, Black, Hispanic, Native American, and white community. And what's significant is that for the first time, we were able to get a significant or large enough sample from Asian and Native Americans to include data on them. So we're really excited about that. And as you can see here, some of the topics we touched on, access to dementia care, knowledge and understanding disease, trust in healthcare, and the rest you see there. And one of the things that we learned before I jump into it is, I think we understand there's health disparities. Some communities, unfortunately, are more susceptible to certain diseases than others, including Alzheimer's. But the healthcare disparities are something that I think haven't been focused on enough. And we're really jumping into that with this report to see the barriers that people are experiencing in getting the care for themselves or for their loved ones. So we can go ahead to the next slide. So one of the kind of top line issues that we saw here is that pretty much every community of color experienced discrimination when seeking healthcare. Some more than others, but that seemed to be the common trend amongst all of these communities. And what's unfortunate is that non-white populations expect and experience barriers when navigating this care. And we did with the respondents from caregivers, these numbers were even higher for each of these communities. So as caregivers navigated the system to seek care for their loved ones, they experienced even higher trends of discrimination. And that is very unfortunate because if they are just experiencing discrimination, it means they're not getting the care that they need and deserve. And with this disease, if you're not getting the care that you need and deserve, that is translating to a later diagnosis. And the later you get diagnosed, the more expensive it is for getting the care that you need when you need it. So let me give you an example. When you have a diagnosis of some type of dementia or Alzheimer's in a timely manner, you may have 2, 3, 4 years before the disease really progresses to start making arrangements so that you're in a good place when the disease gets worse. Well, if you get that diagnosis later where you're already at a point where tomorrow you have to make a decision, your options all of a sudden become way more limited and way more expensive. So that is unfortunate, and it's unfortunate that communities of color have to bear that burden more than others. And just one of the types of discriminations that we see is respondents feeling like they're not being listened to by healthcare providers, or they may felt like they're not smart. Obviously, their family members know what's happening, know that there's something wrong with themselves or their loved ones, but they're not being paid attention to as they would like. And that is leading to this delay in diagnosis. So we can go ahead to the next slide. So as I mentioned, discrimination is a barrier to care, including Alzheimer's and dementia care for a significant number of people of color. And while there's a desire for culturally competent providers, there's low confidence that such access is actually being provided. So we all know the importance of having that culturally competent physician or nurse attend to our family members, but it's just not being provided enough. So that is unfortunate. And then particularly with Black Americans, what we saw is that there's a higher level of distrust in clinical trials. And actually half of them doubt that the advances in Alzheimer's treatment will be shared or accessible to them. So we need to make sure that when we find a cure or when we find a disease-altering treatment for Alzheimer's, it is both available and accessible to every community. And just in general, knowledge, awareness, concern, and stigma about Alzheimer's continues to vary across racial groups, but we haven't done a good job of letting these communities understand the key when it comes to Alzheimer's, the red flags and what they should know about the disease as other communities have. So I'm going to leave you with this last slide, which is our website and our 1-800 phone number. So if you go ahead to the next slide. And for any of you who may know individuals who have this disease, who are a caregiver, please refer them to our 800 line, which is a great resource. Once we get to the next slide, you'll see that number. And it is available in over 200 languages. And it is really a lifeline for many of our caregivers who maybe in the middle of the night are caring for their loved one and they have a situation that's not quite an emergency, but they need somebody to walk them through it. That is a great resource. And if they have any questions in general about the disease, it is a place where they can go and call about and get their questions answered. So without further ado, I am going to pass it over to two of our outstanding volunteers, Florence Lam and Yolanda Rogers, who will talk to you a little bit more about what that experience has been like in navigating dementia care for their loved ones. So I'm going to hand it over to them. Florence, why don't you kick us off?
Thank you so much, Daniel. So yeah, I want to talk about my own personal experience with the disease. And just as a little introduction, I am a recent advocate for the Alzheimer's Association in Northern California, and I'm also a current college student at the University of California, Irvine. So regarding my personal experience, my connection with the disease is through my late grandmother. Growing up, I remember that she was always the person who kind of took care of me and was really selfless with her time. And something that I remember my parents telling me was that when I was really young, when I was a baby, my parents were working during the day and also taking classes at night. So then she was the one who was kind of caring for me for the whole day. And she was living in San Francisco at the time. So she would always take me around to go grocery shopping and always visit my favorite Chinese bakeries, which was really fond memory for me. When my family later moved away from the city, she actually lived with us for a few years and would always walk me to school. And afterwards, we would drink tea after school and I would help her cook and garden. And that's how I got really close with her. If we could go to the next slide. I think the next one after this. Yes, thank you. Yes. So you can see that in the smaller picture that I have here on my slide, you can see that this is kind of one of my favorite activities to do with her. It was actually cooking. And this was one of my favorite recipes. It's called zhong in Cantonese, which it's kind of like a sticky rice dumpling with like a lot of different fillings. And this is kind of my favorite recipe. And she would always make a bunch and share it with all of her family and community. So then something that I remember as a kid was that she would always go around the city, like San Francisco, Oakland, Chinatown, looking for the best ingredients to make this recipe. And then she would spend almost like the whole weekend wrapping, preparing, and cooking these sticky rice dumplings just to prepare for everyone. And then I remember my favorite memory was her teaching me how to wrap them and fill them. But obviously mine never turned out as good. Unfortunately, in 2014 and 2015, we started noticing some things that were really concerning to my family. She was beginning to forget things about us. And I think the tipping point when we decided to really look for care and like look for a diagnosis or something from a doctor was when she was actually kind of wandering around, and she would be taking bus routes because she was really self-sufficient, and she would be taking bus routes thinking that she was still living in San Francisco when actually she was living with us in the East Bay. So we were really worried that she was gonna hurt herself or be lost, and then we wouldn't be able to help her in that situation. So then around the same time, we started looking for doctors to start giving us clear answers and a diagnosis for what she was going through. Her first doctor, unfortunately, was actually quite dismissive of her symptoms. And then there was definitely a language barrier because she was not exactly fluent in English. And the doctor kind of dismissed her symptoms and told us that these things were kind of normal for her age, when we knew that they definitely were not. And that we were definitely looking for someone who would actually understand kind of the cultural background, and also kind of who would actually understand what she was going through as an aging elderly person of Chinese background. And with the doctors not really listening and the language barrier making it really difficult, it was really hard for her to communicate with her physician because a lot of things were getting lost in translation. I think the only thing that helped was when my father and my uncle actually had to kind of reach out and find doctors who were fluent in the language in Chinese and Cantonese. And then they were also there. They had to attend each appointment with her to make sure that everyone was on the same page and that she was being understood, and that she also understood what was happening to her. Because I think that's also a big problem with it, where doctors kind of speak to us and then we kind of say we agree with whatever they're saying, but we don't really understand what is happening to us. So then we tried really hard to make sure she was understanding. And this was still around the time when she was, her symptoms were not too bad, and she was still pretty independent, and we were trying to just kind of ease the transition into getting care for her. After a few months, we saw kind of symptoms worsening, which is when we decided to kind of seek long-term care. As Daniel said, when you get that diagnosis later than you should, it's definitely harder and you have limited options when seeking care. So by that point, her condition was deteriorating in 2015, 2016, and we had to look for long-term care options. So we did consider nursing homes, but then of the ones nearby where we could kind of visit her frequently, it just was a lack of cultural competence, where a lot of the staff did not speak Chinese, and we were afraid that she wouldn't be able to communicate, and she would feel like really isolated in that space. So then kind of my uncle kind of made a sacrifice of quitting his job to be her caregiver full time. And that was a huge sacrifice for him. But then I think ultimately it was the right decision because it allowed us to visit her and take care of her. And since he was living nearby, we could always visit her frequently and make sure she was getting all the resources she needed. And then I'm really grateful for that sacrifice by my uncle, because we were able to spend a lot of time with her before she passed in early 2020. While I know she had like a great life and I had so many great memories with her, I really think that maybe getting more resources and having doctors who had better training, better education about this disease, about dementia and Alzheimer's, I think we really could have diagnosed her condition earlier and also spent more time with her before, and kind of easing that transition into care for her in the last years of her life. And that's kind of all I wanted to say. Thank you so much. And I'll pass it on to Yolanda.
Good morning. Thank you for inviting me to be here this morning to share my story. Yolanda Rogers. I'm a advocate, state champion, as well as a board member here at the San Diego Alzheimer's and Imperial Chapter. I'm looking forward to sharing my story, and hopefully that'll help and inform the work moving forward. Next slide, please. These pictures here represent my mother, Irene, and my uncle Chuck, and then my brother and I are in the center. And my mother and my uncle were both an inspiration to our entire family. As siblings, they were just so very close. And unfortunately, they lost their battle to this dreadful disease in September of 2018, less than 24 hours apart. My uncle's wife and my mom and their siblings would ask, how does this happen to a family where within 24 hours you lose two loved ones? And we've wrestled with the story that my uncle could not bear knowing that my mother went and he's still here. So we just rest in that story that they wanted to join each other together. But what's unfortunate is that we never received a timely diagnosis or a proper diagnosis for my mother. I'll speak with her specifically. My brother and I were initially told that the behaviors that she was exhibiting were a result of a grieving spouse. We lost my father in 2010. Then we were told she was just getting old. And at some point along the journey, her primary care, we got a new primary care who still didn't quite understand the concerns we had, or prescribed her a drug to slow down the memory loss. There were no additional tests or screenings conducted immediately. All of a sudden, approximately 4 to 5 years later, her medical summaries that I would get in the mail, I didn't live in the area, I lived 3 hours away. Those summaries would come and began all of a sudden to reflect that my mother was elderly and demented. And around that time, she was referred to a neurologist. Again, there was still no assessments completed to really tell us what was happening other than her being demented. Her journey lasted 8 years. Fortunately, we were able to keep her at home. My brother was with her full time, and we got to a point where she was not able to, he couldn't do the things that she needed for full-time care, being a male, and her not being comfortable as well. So we were able to hire support that came in several times a week, and then a cousin was able to move in. But knowing the cost of facilities, it was a concern as well, particularly in our African-American community when there's maybe lack of resources. So grateful that we were able to take care of her. But the next slide, what we needed, not just finances, but we needed support. We needed a culturally responsive primary care physician. You see, my mother, that generation, African-American, their mindset is that the doctors know best. My mother had minimal education. Neither of my parents asked questions about why they were taking a certain prescription. They likely didn't even read the side effects. And so when meds were prescribed, it's the doctor who knows, and we're going to trust the doctor. And additionally, in the African-American community, particularly in my family, older family members, all had high blood pressure. Many had diabetes. And at some point, I began to start to look at the side effects because I'm getting irritated when I went to the doctor and asked specific questions about why is my mother on 3 different blood pressure medications and 2 statins. After I asked those questions after realizing that a side effect for all of the medications were memory loss. The rationale was not given. The response simply was, we can take her off. And I said, well, I need you to tell me why she was on them in the first place. The doctor became irritated because I was asking questions and admonished me, saying that in the future, if I was going to show up to an appointment, I need to give them a heads up so that they could schedule enough time to deal with my questions. The words "deal with my questions" is a big part of it. So that was frustrating, very dismissive. And so we needed someone that would listen and truly had an interest, that would take the extra time to guide us, one who was knowledgeable about the disease, knowing where to guide us for support, for assistance, and most importantly, a timely diagnosis. We do have, in my mother's line, her father had dementia, or I think it was Alzheimer's actually. And so basically, we just needed access, a caring physician who was not dismissive. And remember, we had 2 of them for her. And we needed someone to go the extra mile, knowing that African Americans suffer with this disease 2 times a greater risk, or greater than other populations, as well as high blood pressure. You don't want to go to race initially as a concern, but it made me go there to think, is her life just to be expected that she's going to have high blood pressure? She's going to get dementia or Alzheimer's or a form thereof. So we are, my hope is that doctors continue to be educated to know how to respond, recognize the questions to ask, recognize that all lives are just as important. And I do know other folks that have been able to navigate the system much easier. And I have since learned a whole lot more. And as a result, next slide, I've been able to educate and support my church family. These are just a representative from the 2019 Walk to End Alzheimer's. And so just making sure that folks are not not shy to ask the questions, to advocate for themselves. When we don't have professionals that we feel that are advocating for us or have our best interests, it's important that we know which questions to ask. And sometimes African Americans are not likely, as we already heard in the research, to participate in clinical trials, but also not feeling like we have the right answers or have enough knowledge to be able to ask those questions. Again, particularly the older generation. So I'm appreciative to be here. I'm hopeful that what I just shared will be information that's helpful as we move forward as a system to support all lives that are affected and impacted by this disease. Thank you very much.
Thank you, Daniel and Florence and Yolanda, for your powerful testimonies. It just, it's these kinds of stories that make, it that much more important that we are providing culturally responsive programming at the local level. Next slide, please. So I'll provide just a brief introduction to our program, and at the end, this slide with how to contact me and the agency is available, so if people have extra, additional questions. I would just say that built into our DNA as a county area agency on aging is an understanding of who lives in our community, what their needs are, and how really we can support them, with the goal of allowing people with Alzheimer's and related dementia to live in the community as long as it's possible. So just in our county, we're dealing with 44, close to 45% of our population right now identifies as Latinx, and the remainder a mix of other races. And we know just the demographics that is going to our Latinx population is going to really increase over the next couple years. Next slide, please. So just briefly, we developed a funded Alzheimer's disease and related dementia program that provides support for Alzheimer's, people with Alzheimer's that live alone. It's one of our targeted population. Individuals with Alzheimer's disease or related dementias that live with a caregiver and a partner, but also individuals with an intellectual or developmental disability that have Alzheimer's or related dementias or are likely to develop it. And we know from the research that in particular, individuals with Down syndrome have a statistically higher probability of developing Alzheimer's and a lot earlier. It starts manifesting itself in the 40s and 50s. So we have a comprehensive case management program that provides respite, transportation, personal care, home modifications, a lot of caregiver support, including supporting the caregiver with case management. It could be counseling, a lot of training, and also other services. Next slide, please. So how do we do this? I think our story starts with dementia-friendly Ventura County. So back in about 2015, we knew, stories like Yolanda's that were coming to us. This is what it means to live in the community with the disease, and these are the helps that we're not receiving. And this is the attitude that the medical community is providing. So we heard that over and over again. And so we started looking at, what can we do? So we investigated becoming a dementia-friendly county, and I believe we are one of 3 right now in the state. So we did our research. One of the members of our board of supervisors at the time asked us to seek designation, and they actually, in our annual area plan that we take to the board of supervisors every year, the supervisor actually asked that language be included that we would seek this designation because it was important to her, because she had family members with Alzheimer's. And so she wanted us to have that designation. So we said, okay. So we formed a community, a board that represented all kinds of sectors of the county to really look at how can we become, a dementia-friendly county. And so we have representatives from healthcare, medical, private, home care agencies. We have people with lived experience to include individuals whose family members and partners have the disease. And so we developed this really, robust, group of really dedicated people that were, the whole goal was to make this county dementia friendly. And so we developed like a work plan and things that we were going to work on, educating, community, training businesses, looking at the different sectors, legal, business, home care, fire, all the different, sectors, and how we can train them to be dementia friendly as well. And one of the things that came up was an opportunity for an administration for community living grant to actually provide the funds that we could, develop a whole program that we really saw was needed. So we said, why not? We'll apply for a federal grant. And so we actually ended up being successful. And so in our grants, we actually, in addition to the Area Agency on Aging, we've partnered with the Alzheimer's Association because they're critical in any program related to Alzheimer's or related dementia. But we also pulled in the Independent Living Resource Center. So with our grant, we provide funds to the Alzheimer's Association and the Independent Living Resource Center. So they each have a staff person that's dedicated to it. So for the Alzheimer's Association, what this looks like is they provide a lot of the training, the care consultation, and the outreach into the community for us. For the Independent Living Resource Center, they are providing the case management to the intellectual and developmental disability population as well. We've been able to take some of our Older Americans Act funds and our family caregiver funds and leverage them and make them go further, really to support these populations where there is a need. So how do we get our referrals? One of the biggest barriers that we heard going into it was, how are you ever going to get people that are going to like self-identify and raise their hand and say, I need help? And so we did a lot of thinking as part of our Dementia Friendly Ventura County group about how can we make this work. So we do get referrals from the Alzheimer's Association and the Independent Living Resource Center and other social service agencies. We are fortunate in our county that we have 3 family caregiver centers, including one that specializes in providing services to monolingual Spanish-speaking caregivers. So we work with our caregiver centers to get referrals to the case management program, but we also have the Coast Caregiver Resource Center that also serves the Tri-County area that also provides referrals to us. We have a lot of people that will self-referral, and we found that with COVID, more and more people are willing to self-identify, in particular, like family members that live out of state. We do screening through our information and referral system. And so we are one of 6 designated aging and disability resource connection programs in the state. And so what we do is when anybody calls in for any type of assistance, we do a simple screening. The screening is to determine people's satisfaction, and it's really it's called the PHQ-2 screening. So they're looking at the level of satisfaction in the last 2 weeks of people been disinterested in life. Based on the results of that simple survey, it will go to another social worker who will actually do a longer screening if there's positive results. And we found that through doing that, we have found a number of individuals that have been out there that needing an assistance, in particular people that live alone. And so sometimes they'll be screened for another program, and it will come out in the conversation that they actually have Alzheimer's or another form of dementia and that they're in need of help. And so we've really not had a lot of issues getting, clientele. It's kind of like you build it and they will come. I think if you build it right and you make it something that's responsive to what the community needs and it's easy to access, people will come to the program. With setting up our whole program, we wanted to make sure that what the service that we were providing was really respective to who lives in our community. And so we make an effort to really hire bicultural and bilingual staff in multiple languages. And so people can talk to, the social worker in the language that they speak. They have an understanding of the culture and the barriers to accessing services and really how we need to, communicate and the words that we need to use, because we all know that differs between, the different populations that you're providing service to. We also make an effort to do continuous training for our social worker staff, as well as our information and referral staff. We provide the training with the Independent Living Center and the Alzheimer's Association, and this is something that they do annually. They all get the training, they all know the signs and the symptoms, but also they get specialized training specific to the Latinx older population and training for dealing with individuals with intellectual and developmental disabilities as well. And all training provided is personal care. It's person-centered care. Next slide. So that's it about our program. There's a lot more to it. So if anybody's interested in, applying for one of these grants or setting up a dementia-friendly community, please contact me. I have my information provided here. Thank you.
Fantastic. Thank you so much, Victoria, for the informative presentation that you just gave, as a lot of our community members need this information, whether they know about your organization or they just need to inform themselves a little more and just spread the word and tell their fellow peers, family member about this information. Today, I'm very happy and honored to be here virtually with everyone to talk about the services that are available for family caregivers. Next slide, please. I'm here representing Southern Caregiver Resource Center. Some individuals may know who we are, what we are about, or the kind of services that we offer, but I'm here to tell everyone that we are really here to help the family caregiver. Florence gave her a beautiful testimony about her experience that she had being a caregiver, whether maybe she admits that she's a caregiver, she recognizes it, or maybe she does not fully yet, but hopefully at the end of this presentation, she will. But all of the services that I'm about to talk about in this presentation, again, are for the family caregiver, the individual who does the caring. We are here to care for those who care for others, because oftentimes, let's talk about the caregiver journey. The caregiver journey can be very difficult, and oftentimes we forget to care for ourselves. And I'm speaking from personal experience, and as a professional service provider, I know that caregivers, we forget to care for ourselves, because let's face it, we do it all as caregivers. We become, whether you're a parent, whether you're a full-time worker, we do all this caring while picking up on a variety of different responsibilities when we're caring for our loved one that may have a form of dementia like Alzheimer's, that may have a cognitive impairment like traumatic brain injury, or maybe we're just caring for a frail older adult. We become the cook, we become the driver, we become the legal advisor. We help this individual with all of the activities of daily living that we do on a daily basis. And sometimes these activities can become overwhelming. And one of the things that I've seen alongside my team of one of the reasons why caregivers don't reach out to us, why they don't accept the help, or why they're receptive to receiving that extra support is because, one, they have a fear of deportation within the Latino community, or just an individual that's undocumented, they don't reach out to us because they believe we're going to ask for proof of documentation, and that's not true. We don't ask for that. Some of them don't reach out to us because there's a language barrier, but fortunate enough at Southern Caregiver Resource Center, we speak both English and Espanol, in Spanish as well. And we're really here to help everyone within our community. That is the Asian community, African American community, the Latino community. We're really here to help everyone, because at the end of the day, we are all caregivers. Again, whether you identify as a caregiver yourself, you've been a caregiver yourself, or you maybe know someone who's a caregiver, whether that's a part-time caregiver or 24-hour full-time caregiver. At the end of the day, we are all caregivers. There's just different levels of caregiving, but really Southern Caregiver Resource Center is here to help you and help the caregiver with it all. Next, please. We're very fortunate to form part of a larger collaborative effort. Southern Caregiver Resource Center specifically is located in the southern area. We're located off in Kearney Mesa, but we are again part of a larger collaborative effort of caregiver resource centers. We form a part of a nonprofits, 11 caregiver resource centers that are scattered around throughout the state of California. And we really are here to offer free services to the family caregiver, that much needed support that is offered statewide, all throughout, again, the state of California. These organizations, again, offer free services to the family caregiver, and some of these services may vary depending on the location, depending on the community that they're serving, the geographical numbers, of course. Again, some of these services may vary, but specifically the services that I'm going to talk about today are the services that we offer at Southern Caregiver Resource Center. These services are offered all throughout the San Diego County. We are here to help the family caregiver who's caring for someone with a form of dementia, Alzheimer's, again, a cognitive impairment, maybe an older adult child who is 18 years or older, or maybe you as a caregiver, you know a caregiver who's caring for someone who is a frail older adult that is 60 years and older. These services are for that caregiver. Now, if you are located outside of the San Diego County, there's no need to worry. Again, we're part of a larger collaborative effort. You can go ahead and check out our statewide website of our caregiver resource centers at www.caregivercalifornia.org. And you can, based on your location, type in your zip code and see what caregiver resource center is around you and closest to you. And based on that location, you can check out and get more information on the kind of services that are available to you within your location. Next, please. Now, the first step to connect with us, to connect with all the Caregiver Resource Center, is of course to pick up the phone and call us, let us know, hey, I'm a family caregiver, I would like to utilize your services. At Southern Caregiver Resource Center, you can check out our website at caregivercenter.org or connect with us personally at 800-827-1008. After you pick up the phone and you let us know, hey, I'm a caregiver, I need your help, I need to access some of the services that you offer, we will definitely connect with you and get you squared away. Our intake coordinator is the first individual that you speak to. This individual will assess your personalized situation, because we all know that caregivers have different situations and personalized situations. And after that, you will be connected with a family consultant. The family consultant, it may sound a little cheesy, but I always like to say that after you call us, the family consultant will essentially be your best friend throughout your caregiver journey. Because a lot of the times as caregivers, we may not necessarily relate to others who are not caregivers, who are not caring for someone with a form of dementia or Alzheimer's. So sometimes it's difficult to receive that support that we may need. Now, the family consultant will connect you to all of these services that are on the screen. Maybe you just need a few of them, maybe you just need one of them, or maybe again, you need to utilize all these services. The family consultant will again assess your situation, and depending on your situation, you will, he or she will create a very specialized plan. This specialized plan will include, for example, maybe a support group. which is one of our services, our support groups. Our support groups are professionally facilitated at all times by a master's level clinician. And during this time, especially right now, I know that the COVID-19 vaccine is out, but we are not 100% back to normalcy. Things are still different, especially for the caregiver, especially if we're caring for someone that is immunocompromised. Sometimes, again, right now, we need that human interaction as caregivers. We need that support. So in our support groups, our caregivers can connect with other individuals that may or may not be going through the same situation as they are. And also they can obtain some tips, they can obtain some advice, or simply the support groups can easily be used as me time, some time to relax. And again, just have that that human interaction that our caregivers need. Now, on the other hand, we do have caregivers that may be attending other support groups at other organizations, other facilities, at their hospital, or sometimes maybe they just don't necessarily want that large group setting, and that is 100% okay. We do offer another service, which is our counseling sessions. During our counseling sessions, again, they're facilitated always by a master's level clinician who understands your situation and who understands what you're going through. Our master's level clinician will again give you a personal one-on-one support to help you facilitate and help you better navigate your caregiver journey, which can be very overwhelming. Now, if you don't want to utilize our support groups or counseling sessions, we also, surprise, surprise, have many other services that are available to you for free, and there is no catch. These services are for free for the founding caregiver. We offer our education and training services. As a community educator, I may be a little biased. This is my department. I really, alongside my team, try to empower our community by raising awareness on what caregivers do. Because again, not a lot of individuals, in fact, there are rarely any individuals that personally identify as caregivers. We often think that the caregiver is a paid professional at a hospital, like a nurse or a doctor or a care provider at a facility. But no, we are all caregivers. So in our education and training department, you can find our pre-recorded presentations, our pre-recorded workshops, or our live stream classes that we have on our website, caregivercenter.org. And you can learn more about your loved one's diagnosis, what is Alzheimer's, the different types of dementias, what to do in an emergency disaster, emergency preparedness, what's going to happen with your loved one, what to do when you're thinking about meal planning for your loved one. If your loved one has Alzheimer's, whether it's progressive or it hasn't progressed, your loved one's meal in the meal plan will change, and not only for your loved one, but the whole experience will change for you as well. So we have a variety of diverse classes that are offered in both English and Spanish on our website. And again, if you don't have time to watch our live stream classes or anything, our events, these are always pre-recorded and they're there on our website, so you can always go back and check them out. Spread the word, share them to your siblings, share them to your loved ones, family members, coworkers. All of these resources are available on our website for free. So if you're located outside the state of California, our education and training services will always be accessible to you from anywhere. Another of our services that is very popular here at Southern Caregiver Resource Center is that we have our Respite Care program. Our Respite Care program essentially provides a much needed break for the caregiver. As a caregiver, sometimes you just need to step away from your caregiving responsibilities. Maybe that's because you need to go to a doctor's appointment, a dentist appointment. I've had individuals, caregivers that come to me and they say, I have a dentist appointment in Mexico on the other side of the border in Tijuana, and I need someone to come care for my mom, come care for my spouse. But I have no one to help me during this time, but I really need to go to this appointment. So during this time, we offer a temporary support to the caregiver for free. So if you do need to go grocery shopping, if you do need to go to that much needed appointment to focus on self-care, to take care of yourself, we will send a professional caregiver that has been background checked fingerprint check has been fingerprinted. That is a professional who knows what they're doing to go take care of your loved one during this period. Of course, always taking the CDC and county health recommendations, because again, we're still in a pandemic. So, but we do keep this service because our caregivers need this much needed support, this much needed break from their caregiving responsibilities. So that is our respite care program. And again, there is no catch. It's just something that it's made possible by grants and donations that we receive. And again, that's our respite care program. We also offer legal and financial consultation. During this time with the COVID-19 pandemic, especially when it began, our caregivers did not know what to do with their loved one's will, with a power of attorney, with a healthcare directives. If you need help with these documents, we partner with attorneys and lawyers that can help you with these documents for free. So feel free to contact us. Feel free to check out our website for more of these services that we offer, because as you can see on the screen, we have a variety of other services that are available to you. I know that it's difficult to ask for help, but it does not have to be hard. As a former caregiver, I know that it is very important to utilize the free services that are available to us within our community. And it only helps us as caregivers. Again, spread the word. If you know a caregiver, if you're a service provider, connect them to Southern Caregiver Resource Center and to the caregiver resource centers within the state of California. Next, please. In our iCare portal, you can find all of this information, including what I just talked about, our services, our education and training, workshops, classes, events. All of this is available on our iCare portal at caregivercenter.org. You can listen to our podcast, our Caregiver Corner newsletters, our health bulletins, our caregiver events bulletins that we're having as well. This is essentially where we have all of our information. So feel free to check it out, connect with us right away, because we're here to help. Next. This is our personal information. If you are located outside the state of, outside the San Diego County, feel free to connect with me. Feel free to connect with any of my colleagues through this phone number, 800-827-1008, and we will get you squared away and get you the help that you need. There is help outside of the San Diego County, of course. Again, we're part of a larger collaborative effort. So feel free to connect with us. I'm very happy to be here. I hope this information was helpful to all of you. And thank you so much. I appreciate it.
Thank you so much, everybody. That was a fantastic presentation, and we want to make sure that we turn to Q&A. I know there's been some activity in the Q&A box and a discussion happening there. I just want to recognize that participants are really glad to hear from both Florence and Yolanda about their personal experience. We know that these personal stories really hit it home. I just want to pause here and see if anybody else has questions or comments. If you're joining by Zoom webinar, you can use the Q&A function, or you can raise your hand and we'll unmute your line and hear directly from you. If you're dialing in by phone, it's *9, and that will allow us to see that you have a question or comment, and we can unmute your line that way. So let's take a look. Just a comment from Angelica. Angelica is happy to hear Ventura County is dementia friendly. My mom lives there and is now experiencing symptoms. I'm nearby in Santa Barbara County. Thank you. Anybody else have questions or comments? Okay, we've got one from Melissa. How is care coordinated with the health plan or provider organization's case manager? Does anybody want to respond to that? Daniel, I don't mean to put you on the spot. Do you have any sense of how that's done, the coordination?
Hi, that's not really my area of expertise. All I do know is that, so I don't know the semantics of it, but all I know is that when that relationship is established, they figure out a way to really work collaboratively so that the individual is getting the a better coordinated care as opposed to them going at it by themselves. But as far as exactly how that happens, I am not unfortunately keen to that.
Understood.
This is Victoria. I can answer it just from our perspective. So we do have various case management programs, and what we typically do is we have a release, and we, depending on the program, we'll pull the medical records or talk to the physician. And so the connection starts on our end, really just to understand, more of what the actual diagnosis is. And it really helps in us determining what our plan of treatment is going to be for the individual.
Thank you, Victoria. A couple more questions coming in. I think this one is for Valeria. Does Southern Caregiver Resource Center offer free respite care all over the state? This individual is in Northern California, and they're wondering how they can get services.
Yes, of course. Yes, so depending on your location, the majority of the caregiver resource centers that are, again, all throughout the state of California, we do offer respite care, and it's for free. It just depends on the amount, again, the budget that they receive, the donations that they receive, because the respite care service that we offer specifically at Southern Caregiver Resource Center is based on the certain amount of hours that we can provide to each of our caregivers. So it just depends on the location that they are in, but the majority of us do offer respite care, our respite care services.
Thank you so much, Valeria. All right, and Bob, I think you had your hand up, but you put it down. If you still have a question or comment, feel free to jump in there. Back to you, Valeria. Does Southern Caregiver Resource Center offer speech therapy for my mother who was recently diagnosed with progressive aphasia?
No, unfortunately, we do not offer speech therapy. All of the services that we offer, again, all in the state of California, the Caregiver Resource Centers, all of these services are specifically for the caregiver. A lot of the times, again, most of the services are for the care receiver, the loved one or the patient, but the services that we provide specifically at SCRC, or in general, all the caregiver resource centers in the state of California, are specifically for the caregiver. So in that case, we don't offer any sort of speech therapy classes for the care receiver who is receiving the care.
Thank you very much. A question from Bob. I see you put it in the Q&A. So for the testimonials we heard today, how can the stories be shared with more than the 137 folks that are on the webinar? Are there any plans to share these stories with legislators at the upcoming National Alzheimer's Forum? Daniel, I don't know if you can speak to that.
Yes, absolutely. And that is exactly what we plan to do. And, we have a once a year event, which was mentioned here, was our Alzheimer's National Forum, where we'll give these individuals a platform to share their story with legislators in an effort to advance certain legislation with their members of Congress. But throughout the year, we're also engaging in advocacy efforts in their own community. So if anybody has a story, or if anybody is passionate about this and really wants to take this to the next level to help advocate for public policy that can help everyone, I definitely encourage you to reach out to the association, and we can put you in touch with the person doing the grassroots advocacy so you can tell your story.
Thank you so much, Daniel. And I want to turn to Dolores, who's had her hand up. Dolores, we've opened your line, so you should be able to unmute and then ask your question or make your comment. We'll give you a couple seconds.
Yeah, hi, thank you. I wondered if there are if programs in other languages besides the ones that we've heard about. Could any of the speakers address the issue of multiple languages that caregivers might need to be addressed in?
Yes, I can take on that question. Great question, Dolores. At Southern Caregiver Resource Centers, again, with the Caregiver Resource Centers throughout the state of California, we do offer a variety of other programs. Some services may be a little different, again, based on the location. And some of these services include other languages. So that could be, again, Spanish, that could be Tagalog. You just need to go ahead and check out our website, and based on your location, you can see what kind of services they offer and what different languages they have it in.
I could also just jump in and add, our 800 number with the association. We have master's level clinicians on the other side who can help folks through any type of situation and direct them to resources in their community in over 200 different languages. So that number is 800-272-3900. Again, 800-272-3900. And it is just a great resource to help connect folks to the services that they need, and even talk through a certain situation, non-emergency, that they may need in caring for their loved one.
And from a AAA perspective, we do provide services in the threshold languages in the county, and those that we do not speak, we use language line interpreters. And so people really should be able to access services in the language that they speak through at least the language lines.
Thank you all so much. And I do want to recognize that we're 11:01. I know, Jane, you still have your hand raised, and I would just encourage you to submit your comment or question using that engage@aging.ca.gov email. We'll do what we can to get back to you. Same with others who have questions that we weren't able to answer. And I will pass it off to Amanda for closing remarks. Thank you.
Thank you, Maria, and thank you so much to each of our speakers today. You can tell from the comments from our participants how valuable these resources are and this information, and the need to continue to improve the cultural competency of our Alzheimer's and dementia care and support. Endless gratitude to you all, and I want to thank everyone for joining us today. Please stay safe, be well. See you next month. Goodbye.